What is PACE? Well, PACE is a national program designed for older adults who want to maintain their independence, even continue to live in their homes, but need assistance when it comes to managing their medical and social needs. And so I ask you now, just you don't have to answer this, but does that describe anyone that you know? Someone that might be struggling, someone at home, someone who might need some help. Could be a neighbor, could be a parent, could be an aunt and uncle, someone down the street.
Welcome to the Rotary Club of Jonesboro. Our speaker introduction will be done by Brian Riga.
Two things you're likely to notice about Bob Harris right away. You'll say, that voice is familiar. And later on, after you get to know him, is this guy really this nice? Bob has the enviable quality to make whomever he's speaking to feel that he's focused only on them and what they're saying, like they're the only person in the room. And it's true. On a personal note, Bob was one of the first people that I met when I moved to Jonesboro 40 years ago this fall. Bob. He was Dick Clay's protege as the weekend sports anchor, and I was a camera operator at KAIT. He was nice then, too. He learned all our names, and he asked about our school and our families and all that, even though I had absolutely nothing that he wanted or needed. Bob went on to found AdPro Video, producing educational and industrial, commercial and promotional videos, telling people stories and helping to sell their products. He recently joined St. Bernard's Total Life Healthcare, where he continues to care about people's stories and connects them to someone who can help. Ladies and gentlemen of the Rotary Club of Jonesboro, my friend, Bob Harris.
Brian, thank you very much. That was very, very humbling. And I remember those days well, even 40 years ago. I'm grateful to be here. When Jill told me that she had me scheduled to be here, I was excited because I remember this club from years ago. And I said, I know there'll be a lot of familiar faces, and I'm not disappointed today. So thank you for having me. As I've done a lot of different things. But what I'm doing with Total Life Healthcare, and I'm going to get to that real quick. I don't know that I've enjoyed a job, a function any more than the one I have today. And I'm grateful to be around people that care about people in general. And I know you're part of that group by being in Rotary. I know you know exactly what I'm talking about, but it's very humbling. And when we go at home at night, we feel good about what we're doing because we're trying to help somebody somewhere have a better life. And so I thank all of you, and the ones in this room know who they are. There's so many people that are familiar with Total Life Healthcare at St. Bernard's, and there's so many that aren't. So I'm going to get right quick. Would you raise your hand if you're familiar with this program at all? Because it's going to tell us some information. That's good. We like to hear that. For those that you have not, I'm going to give you a little brief description of the program, and we will thank you. Thank you very much. If you're familiar with the program, it'll be just a little refresher course, and I hope it'll be a good one. And if I'm making any mistakes, I have enough bosses in this room that'll correct me right away, and I hope they do. So here we go. St. Bernard's Total Life Healthcare was the first established PACE center in Arkansas, and this was back in 2008. So we're about to have a 14th birthday, 14 years old. As old as the program is, my function is to explain this program to those that don't know anything about it. And every day I run into people that don't. And it's a fun thing to do to explain it to someone, especially when we're trying to help them with their loved ones and those and their families that may need some help. But the program, there are 3 PACE programs in Arkansas. This was the first one, as I said a moment ago. There's one in North Little Rock and one in Springdale. And so that's one of the questions, this is just a little slow. What is PACE? Well, PACE is a national program designed for older adults who want to maintain their independence, even continue to live in their homes, but need assistance when it comes to managing their medical and social needs. And so I ask you now, just you don't have to answer this, but does that describe anyone that you know? Someone that might be struggling, someone at home, someone who might need some help. It could be a neighbor, it could be a parent, it could be an aunt and uncle, someone down the street. Think about that for a moment, because I think you'll have an answer. It's the most successful model of healthcare to keep the elderly out of nursing homes or other long-term care facilities. I don't want to say anything about any long-lasting, long-term care facility, because we need them. But I don't know many people that if they have a choice, where would they want to stay? I think most of you would say at home. Now, you could live somewhere else. You could retire and go to Bahamas or Hawaii or wherever, but I think you'd want to be wherever you are, at home. And the studies that we go through tell us that we do better at home. After we get out of the hospital, we recuperate. We just live better. And that goes along with this program. Those that can get into this program and qualify for the program live a considerably better life. They live a longer life. They have a better quality of life. And that's something we work on every day, and it's really important to us, and it's going to unveil itself here in just a minute. This is our medical director, Dr. Jim Murray, and he's not here today, but if he were, he'd probably say something that he quoted several months ago. By joining forces and using our collective knowledge, the PACE team is able to care for the elderly in a way that better meets their unique needs. The words there that he's talking about, collective knowledge and the team approach, and that's also going to go into our next slide here. I think this is probably what sets PACE apart, at least when I speak about this to others. This is what comes to mind. We have an interdisciplinary team. It's made up of the people that are up on that board there, from a registered nurse to a recreation therapist, a dietitian, occupational therapist. I'll go through them quickly. PACE center manager, a home care coordinator, a personal care attendant, a driver, which is very important, primary care provider, a master of social work, physical therapist. So once a participant's in our program, they're overseen by this entire team, not only the physician and their nurses and case managers, but an entire team. And that can go into a lot of different things there. And probably don't have time to go into everything, but from the physical therapy standpoint, when they're in the program, they'll get the physical therapy they need based on their need for as long as they need it until they get better. They'll get a driver, a transportation, and that's a very, very important nerve center of our operation at PACE, because we have to take care of them and make sure they're transported to our facility and taken back home. And when they're in the facility, they have time to see a physician, their therapist, and questions. If they have questions, the questions they have can be answered anytime. And I think it's kind of astonishing when you're in a situation like we're in, where you can get answers right away. The wheel of people on that board that you see there, they know just about everything about our participants. If you'd call them right this moment and ask about Mrs. Jones, they'd have a detailed report to tell you about Mrs. Jones, where she is and what she's doing and what we're doing to help her. And so that team meets on a regular basis. And what's so neat about it, they have a creative way and a freedom to come up with a managed care plan for that participant. And they come up with some neat things to do to be able to make things better, to take care of obstacles that are in the way sometimes. And that's a very important part of PACE. And to me, it's the magic that makes it work, that wheel that you see right there. And it's not something you'd see just anywhere. I think sometimes if all healthcare worked this way, we'd have a different complexion altogether with the way people are handled. And we're dealing with an elderly basis, an elderly population that are so often overlooked and underserved. And we realize that when they're in the program, we take a special interest in them. We get to know them like family. And the wheel that I showed you that I'm referring back to again, all those involved on that wheel know these participants quite well. They know their names, they know their family members most of the time, and they can tell you so much about them and have such a caring way to handle them when they're in our program. Eligibility, we get that question a lot. Must be over 55, a resident of a service area, and we cover about 7 surrounding counties. DHS certified, TLH approved. And What does it cost? That's another good question. Well, it's no cost for services for participants who have Medicare with Medicaid or Medicaid only. I'll answer any questions you have on that in a moment before we get too far into it. But Total Life Healthcare receives a capitated payment monthly for each participant from Medicare and Medicaid. And Total Life Healthcare participants may be fully and personally liable for cost if they receive services from out of the network provider. And the triggers to refer, you say, well, who is really eligible? Who are you looking for? Well, the people on this list are just a few of them, and it's a high fall risk. And I know we probably all know someone who's at a high fall risk. My mom and dad are. They're in their 90s. They live at home. My sister and I are their PACE program. They're not in this program, and I wish they were. If my sister and I were not able to take care of their needs that they're having now, we'd have to look at something else. We'd have to look at another option. Little or no family support. You know anybody there? How about multiple admissions to hospital, dementia, or Alzheimer's diagnosis, at risk of nursing home placement, low income, unable to fill medications? Made this up and spoke to the Jonesboro Police Department when I first started working at Total Life Health, and found out that they have, they're probably close to 2,000 welfare checks they make each year. That's welfare checks checking on someone that might need some help. Not all of those are these risks, obviously, but a big percentage of them are. And I made this little card up so they could place it in their vehicles, and these are the main points. And I end up giving them to a lot of different people, because this is what we look for a lot of times when we're talking to someone and they ask questions about this program and who's really eligible. And so, again, I ask you, do you know anyone that fits in this area? It could be someone that you know closely, it's a family member, someone down the street. I walk my neighborhood on a regular basis, and I was walking my dog just a few weeks ago, and I ran into an elderly lady's daughter, and she said, my mom's needing help. She knew that I was working at St. Bernard's, didn't know exactly what my job function was, but she said, I need some help. So her mother was having problems, starting to fall, and she did need some help. So it was an opportunity to tell her about the program. And those are things that we look for. And that's just an example. We can meet people on the street. I can talk to you here today, and I hope that this has put something in your head to think of somebody that you know that might need our service. The best part about it, you become a hero because you're looking out for somebody. And if you give us a name and a phone number of someone you think might need our service, you'll end up doing something that you never thought was possible. And that's referring someone, and whether they make it into our program or not, it's not so important. You're aware of this program. They are aware of an option that they have. And so that's what's important to us. But this is an important card for me because I take it with me wherever I go. I pretty well know it by heart by now, but these are triggers. These are people that probably would be well suited in our program. And we found that there's so many people in our service area that could benefit from our program. They're just not enrolled. And so we're trying to find them and get them enrolled. Call now to refer. This is not one of those call now and you'll get an extra Vegematic or something. I use the word now because it's crucial that we find if there's someone that needs to be in this program, we'd like to get them at a good time in their life. It's a time when they're usually struggling. Sometimes if we wait too late, we're not able to help them like we would want to. And so I say call now to refer. This is just a challenge to you as Rotary Club members. You don't have to do much at all except call. There's a number right there. That's our main number. Call and give us a name. We'll put you in contact with the right person. We have an intake team that just does an incredible job in dealing with elderly and dealing with the questions, and they know how to handle it. They know how to explain this program once we talk to someone on the phone. But that's important. We're located at 505 East Matthews on the Matthews Mile there. So I usually try to end these presentations by giving you an invitation to personally give you a tour of our facility. That's a standing invitation anytime because it's difficult to tell you everything about the program in the time we have here this afternoon. Seeing is believing, and we have a program that is like none other that I've ever seen. And if you're in this room and you're familiar with it, I think you'd probably agree with me. It's a program and it helps people. We do it every day. Someone described it as an inside-out nursing home. We do everything a nursing home does, except at the end of the day, our participants, they go home. Our employees go home, and we feel good about what we're doing because we've gotten to know people, and most of our participants are like family to us. And that's another thing that I feel like we're blessed to live in a community that is so driven medically, and we're progressive. We're always looking for something to do to make things better for our lives. And when it comes to the medical community, when it comes to us and our population and the ones that we're talking about here, we're looking at a population that needs help. That's all they need. You don't have to spend any money. You just have to look out for them and give us a phone call and let us know that someone out there that we can contact that we might help for you. And I go back to this, you become the hero. It's not necessarily us. You do, because you've done something that somebody else has not done. You've referred them. And that's all that it takes, a phone number and their name. If you get a chance to talk to them, that makes it even better. They know that you're looking out for them. And I was able to talk to one of our physical therapists who's been with the program almost since it started. Her name's Brandy Leblong. You may know her. And she's very passionate about what she does. It's going to give you call this a micro tour of our facility. I did this very quickly because I wanted you all to see what I could show you today. And I hope this comes up.
From your nurse to therapy to a hot meal to needing to go to the dentist and even providing transportation and all your medication. We all work together as a team, and teamwork is one of the reasons that sets us apart. I'm a physical therapist. Actually have been here with Total Life for over a little bit of 12 years, and I've really gotten to see the program grow. When I started, it was known as the best kept secret in town, and now it's how can I be a part of this program? We get to know you very well, get to see all the progression. There really is no limit. It is all based on need to get you functional, to get you at that level needed to stay independently within your home with all the help of Total Life Health Services, whether that's aid services or coming to our day place that we have to offer, or the continued therapy just to keep you mobile in the home as well. And also, I think what is very outstanding with this program is we get to know you like family. If you were to enter the hospital, then we follow you there. We know what your needs are. We know what your heart is. We know if it's just a simple smile, a simple touch, even the communication from us to your family, let them know that you're fine, that you're okay. I'm just very blessed and pleased to be a part of Total Life Healthcare.
Brandy was just one of them in our facility that feels that way. If you notice a smile on her face, that's the way it is in our facility. I'm saying this from an insider too, because I'd not been in a situation like that before, where I went to work and people were happy to be where they were and you knew they enjoyed what they were doing. Not everything's perfect, but this is close as it's gotten for me in my career to see these things happen. I get to see it every day. That's the blessing that I get. And our participants get the blessing and the friendship of those in our facility that work with them, our medical team, our entire team. And this gives an overview, I hope, of the program at Total Life Health. If you have any questions, I'm here to answer anything that you might have. And if you want to call me, you can do that also. But
Okay, this is Jill Clogston. My question is, I know it says no payment needed for Medicare with Medicaid or Medicaid, but what if the folks only have Medicare that they? So is it a situation where they have to qualify for Medicaid before they could get in?
they have to have Medicaid.
Okay.
They can have Medicaid and Medicare.
Gotcha.
If they have other, it might be compromised if they have other supplemental insurance. But we can work, we have a way of working that out. And that's a real good question, Jill, because some people think, well, we make too much money for this program. That can be true, but there are ways to handle that sometimes. There's reposition of assets, and that happens a lot. It's not uncommon, I'll put it that way. And, but we work those things out. I think our main focus is to talk to them with our team. Once our team's gone in and assessed their situation, we feel pretty comfortable about the next step, and that's for DHS to check out to make sure that they qualify on their end. But we try to work that out as early as we can and answer their questions as we go along. And that's one way of doing that. Welcome.
Bob, this is Sam Hummelstein, but I'm asking for one of our Zoom participants, Marty Allen. Does PACE work with or help participants who have pets?
I'm getting my boss to make sure that, yes, we do. We've spoken about that recently in some of our meetings. Yes, we do. We do. And it's funny, sometimes I've talked about being creative. Sometimes we have to be creative on how we take care of those animals and their pets. Let's say they have an appointment, but no one's going to be able to take care of their dog. We're often settled with those situations, and but the quick answer to that is that's a friendly yes and a welcome yes. It happens.
Bill Burnett, I'm not sure exactly, again, what all the program does. You know, back you had the list a while ago of the criteria or things that say if my parents had Alzheimer's, but I'm getting up and I'm going to work, what can I expect of PACE? Is the patient staying or the person staying in their home by themselves? Is someone coming to get them for all day? I'm still not exactly sure of the time frame that y'all are providing services to the individual compared to the time frame I'm still going to be responsible for providing services for my loved one.
The answer to that can be handled. It's based on needs. And so if it were an Alzheimer's patient, we have a club PACE for an Alzheimer's patient, where they can spend the day with us if they need to. There's an option also, besides their own caregivers, we have an aid service that can come in sometimes and help. We have social workers that work with them. And we just work out, that's where we work out with a plan that works best for that participant and for their caregivers. So I hope that answered your question. I'm still with you if I didn't answer it completely. Did that? We come up with a plan that'll work for you. That's our job.
Claudia Shannon. I know one person who was on Total Life. She's now passed away, but she was a resident of St. Bernard's Village in the assisted living. Does this program continue to work when you go there?
Yes. Yeah, absolutely. Absolutely. Makes it easy sometimes.
Outposted. How many do you have in this program?
Right now, about 270. I'd say around 270.
270?
Around 270.
Okay, my next question is like, you said you drive and pick them up and bring them in. How many drivers do you have? And
Well, I don't know how many full-time that we have right now. We normally do. I'm going to try to repeat her answer for those that might not have heard her back in the back, but we have about 7 full-time drivers. We're in need of drivers right now, and it is a good position to be in. If you know somebody that's a good driver who likes people, we need them desperately. And there are benefits to being a driver for this program. And if you know anybody at all that's interested, part-time or full-time position, I'd hope you'd call our facility and talk to our transportation coordinator. We're searching for them. It's a good job. You have a lot of fun. You get to meet some neat people. And I hope I answered that correctly. I hope you understood that. Did that come across? Okay.
Any other questions? Okay.
Well, I thank you again for being here. It's nice to see so many faces. The older I've gotten, the more I like to see people that I know. And I know about everybody here, and I feel good about that. And I'm thankful to know you, thankful you're here, thankful you're part of Rotary, because you do good things. And I hope this was something that was interesting to you. If you don't know anything about it, my only request, will you tell somebody about it? If you don't have any more questions and you leave, and call us with referrals. It always makes a good day when we get a referral, especially from people like you that we know. So thank you so much. Thank you for having me.
Bob, I have a token here to commemorate, your visit and presentation to the club. This is Paul Harris, the founder of Rotary, and on the back is a 4-way test. I'll share that with you. Okay, thank you so much. Appreciate it.
Thank you.